One pump is called estrogel. This pump we are using for what? For basically HRT, endometrial preparation. And the other pump is called Androtas or Androgel, and this 75 gram and it is 1% gel. We use it for what? Poor ovarian postpartum. Now we'll move ahead. We've got recombinant FSH, which comes in a PFS of 75 and 150. We've got multi-dose. Multi-dose can be 1200, can be 900, and then we have, which comes with a syringe. Then we've got pens. Pens can again be 900 or 1200. They come, or maybe lesser depending upon the company, which comes with a needle and it's got a particular volume setting you can do from the pen. So this is about the pre-filled, about from the PFS to the liquid form. So recombinant FSH we are not getting in the powder form. That's what I want to tell you. Coming to HMG, HMG can come to you in a powder form. Which can be reconstituted. HMG I'm talking about. HMG comes in a liquid form, which is need 600 units. Need not to be diluted, and then it comes in pre-filled syringes also. So HMG has got the complete range, and the range of recombinant is that recombinant doesn't come in a powder form. And why do we use a powder form also? Today we should not use the powder form also. We should go in for a multi-dose vial or a PFS syringe. So I think I'm done with this. Then I'll come to HCG. HCG is coming like a vial like this, and it is HCG we are normally is in a powder form. Yes. And we can also use something like recombinant, which comes as a pre-filled syringe. HCG comes as 2000, it comes as 5000, it comes as 10,000. And for trigger, we can also use something called decapeptide 0.1 milligram, or we can use loprite. So here am I. After this, let's go to our favorite drug, which we use very frequently, Cetro. Cetro comes as a powder form, which can be reconstituted, and it also comes in a pre-filled syringe. So Cetro, again, if you look at it, the Cetro is 0.25 milligram per 0.5 ml. So it's a very neat one. Anyone can inject at home. So in case you ask me, what is the right for you guys? To, as you begin your careers, the people like you who are mature and doing a lot of work. So for them, you can experiment with multi-dose vials. The best, cheaper, economical. You can use, for in case people are educated, go for pens, definitely. But I feel that even now, when I get my patients, I prefer to give them a PFS. PFS is, just give them, usko bolo, you can tell them. Suppose I am looking at now the grey injection. Now this is my recombinant FSH 225. मैं इसको 5 दूंगा, बोलूँगा 5 दिन हर रोज एक लगा ले. So she's not having any agony to take out a multi-dose vial, put a spirit swab, sterilize it. So she opens this pack and utilizes it. The problem with this is the most beautiful thing, but for educated people. And then HMG again, reconstitution is always, I don't like reconstitution. But HMG is, depending upon from where we come from, it can be done. But I'll prefer to give people PFS or a multi-dose. They come very cheap, and for triggering, again, my favorite will be using something like, which is in a PFS format. But this is my way of working. You can pick up your way of working. So PFS is always more comfortable for me. And Cetro again, powder or PFS, depending upon what you like to give. So take home message will be that we should be using either liquid form. Liquid forms are multi-dose liquid forms, very easy to handle, and you get some units always spare which you can use for some other patients, or the PFS range is what I always like to go in for. But depending upon where you are working, suppose you are working in a big institute where you are getting 7 or 8 patients a day, in that case you can take a multi-dose vial and fill few syringes and keep it with you and give it to all and finish it off in one day. But for some other patient, the wastage is much more high in a multi-dose vial because
how long we can keep the multi-dose?
Around 1 month easily you can keep. Yeah. Expiry period. After opening 1 month you can easily keep. No problem. But cold chain is always a problem because she'll take it out and you don't know what she's doing.
Take out and fill the syringe and we'll keep it.
Make the syringes, keep it, but she can't do it at home, no?
No, she can't do it.
You do it for her. Why do you want to make? So I'm saying in today's world, why do you want to make her life uncomfortable? See, think Sunita, you are a patient. Suppose she's a patient. I mean, don't mind, but say I'm a patient. I'm your patient. I come to you for my IVF. You give me 10 syringes filled in an ice pack. This is one way. You make some more money. But I don't want to save my money. I'm okay with spending rupees 50 more, 30 more. So no. But patients have to be told. They have to be told. Once you give them an option. I told you a story yesterday, when Decoit said, I want to take money of your wife and children, I kill them. He says, go and ask your wife and children what is the case. No, we won't take any punishment. It's your call what you want to do with your life. So you can counsel them. I think PFS is a very easy option. पहले 5 दिन पीले वाले टीके लगा ले, उसके बाद आखिरी दिन पे यूँ से फिर आज से सेट्रो शुरू करा है तो 5 दिन संतरे वाले लगा ले. So it's very easy for us. She won't take out everything from her fridge. She'll just open one and she will take it. But this is my perception. My perception may change when I'm heading a big corporate chain. There, my turnover is so fast that I'll only go to a multi-dose vial. Because in one day I'll use 10 multi-dose vials. But for when we are doing around 8, 10, 15 patients a month, I think giving them PFS is a good option. Or a multi-dose vial. Then giving them powder form, because powder form somebody will have to reconstitute, and becomes a big problem. So many times when they reconstitute, they don't reconstitute properly, they leave something in the vial behind. So patients also don't understand much. So this is my way of working. I think I'm done.